Erectile dysfunction is the inability to perform sexually in the way that you want to. In other words, if you can't perform sexually in a way that satisfies you, whether or not it involves an erection, ejaculation, etc., I consider that erectile dysfunction. Erectile dysfunction is very common. In fact, it's felt that over the age of 50, almost half of the men in the United States suffer from erectile dysfunction. And as you get older, even more men. Many conditions cause erectile dysfunction. In particular, blood vessel disease from atherosclerosis, or what we used to call hardening of the arteries, high blood pressure, diabetes, tobacco use, poor lifestyle choices such as lack of exercise, diet, prostate cancer surgery, radiation therapy, major pelvic surgery for cancer, just to name a few. ED is primarily diagnosed by taking a history from the patient. The reason I know a man has erectile dysfunction is that he comes to the office complaining about it. Now, there are other diagnostic tests we can do to find out the cause of the ED, but generally speaking, it's the history. ED can be prevented by basically taking care of your body. In other words, eating a healthy diet, avoiding what we call the SAD diet, standard American diet, which is full of processed foods, sugar, fast food, things like that. Exercising, getting regular checkups by your doctor, not smoking, and staying sexually active. As we say, use it or lose it. The benefits of seeing a specialist for ED are that that's pretty much all we do. And when you go to somebody that does something over and over again, they have a particular expertise that could treat you in a way that most other physicians that treat things in general cannot do. They don't have the depth of understanding that we do. Remember, specialists, we're board certified. We have to study, we have to keep up. And we want to give the best treatments to our patients, because if we don't produce results for you, then you're not going to come back and see us again, and we certainly don't want that. But our main interest is in helping men the best we can, and that's the benefit of seeing a specialist, their expertise. There are many treatment options for erectile dysfunction. The simplest are the oral erectile dysfunction medications such as Viagra, Cialis, Levitra, Stendra. Then the treatment known as penile injection therapy, where you inject the medication into the penis, which works for many men. There's also penile implants, several types of which can be discussed: inflatable, malleable, 3-piece, 2-piece, but that's for another conversation. Then there's a vacuum erection device that works for some men. Then there's the basic treatment of lifestyle changes. There's a number of men who lifestyle change alone, such as changing their diet and exercising, can in and of itself improve their erectile dysfunction. Also, if a man has low testosterone, and that is treated in a way that raises the testosterone to normal, that can also contribute to treating erectile dysfunction, although it may not be the only treatment needed. How we determine what's the best treatment options for you depends on many things. It's going to depend on the testing that we do to find out why you have erectile dysfunction. It's going to depend on what treatment that you may have had, what you responded to, were you treated in a way that maximized the treatment that you already had, and of course, what your choice might be as to what you do or don't want to do. Satisfaction rates for the different kind of treatments vary depending on patients. In other words, some patients are very satisfied using the medications like Viagra or Cialis. Some patients have side effects and they're very dissatisfied. Some patients may start with a particular treatment, not like that. They may want to move to another treatment. So it really does depend on the individual. There's no one specific answer to that question.